Panic gripped a village in Siaya following the isolation of a man in his late 20s at the Siaya District Hospital. The patient was said to be bleeding from the mouth, a common symptom of Ebola. He was then immediately admitted and his blood samples taken to the Kenya Medical Research Institute in Nairobi for laboratory testing.
We are treating the patient as a suspected case. We admitted the patient yesterday after tooth extraction and was bleeding and had a history of blood in urine and some blood stain in feces.
During a spot check by the Standard Group, public health workers at the Busia border were conducting screening exercises on those coming into the country from Uganda. The government has also set up isolation wards for those seen to be exhibiting symptoms closely related to Ebola. This exercise could be the government's way of trying to keep Kenyans calm and the situation under control. Given that testing for Ebola is a complicated task, results must be verified by the Kenya Medical Research Institute and the Center for Disease Control, a process that can take up to a week. In neighboring Uganda, it seems containing the infection rate is proving difficult. Since Monday, 16 more cases have been identified, raising the number of those seemingly infected to 36. 4 of the 36 patients have been diagnosed with Ebola after intensive laboratory tests. According to international media, the death toll has risen to 16.
And avoid promiscuity, because these sicknesses can also go through sex. In the meantime, avoid shaking hands.
Shaking hands is an African culture that is used to show respect when greeting somebody. But this African culture could lead us to some more problems than we had hoped for, because it's also a way that diseases and infections are spread from person to person. Catherine Omwando, KTN.